Hello friends, I am Dr. Adekunle Rowaye, a veterinarian and a pharmaceutical biotechnologist. My area of expertise is drug discovery, and I've worked extensively on COVID-19, looking at different inhibitors of that particular virus. And we're looking at other strategies to combat this menace and this infection that is ravaging the whole globe. Today I want to talk about different things that will help scientists, that will help clinicians, that will help all stakeholders to be able to be informed so that they can fight and combat this global pandemic, as it were.
So tell us a bit about the virus that causes COVID-19.
COVID-19 is caused by the SARS-CoV-2 virus. We have the SARS-CoV virus, which caused the SARS infection in 2002. And then, of course, another coronavirus, which caused the MERS infection, Middle East Respiratory Syndrome, in 2012. But now we have SARS-CoV-2, which causes a kind of sudden acute respiratory syndrome in its victims. It's caused by a kind of coronavirus belonging to the beta group. We have so many variants of this virus, but this particular one, we are told it comes from bats. So there's a kind of zoonotic transmission. It can come from animals. And the danger we hear now is that this virus can stay in our pets, in cats and domesticated animals. So the fatality rate of this virus is about 2 to 5% world over. In some areas, in some countries, we've recorded 8%. Quite different from Lassa fever. Lassa fever, you have about 40%. The MERS infection, you have about 35%. Ebola is the highest, you have about 90%. And SARS infection, you have the first SARS, that was in 2002, you have 10%. So basically, you have a virus that causes a fatality of between 2 to 5%. So it is a tester of the immune system. In other words, if the virus causes fatality of 2 to 5%, that means your immune system can give you a 95% cover on that infection. So that's very important to note, so that we are aware of the therapeutic strategy or the treatment strategy we shall employ.
Who are those vulnerable to this disease?
Yes, we have the elderly people vulnerable, and there's what we call in medicine immunosenescence, in which case your immune system degrades over time, and that's why a good deal of the population, above 80%, are highly vulnerable, beginning from 60 and above, where the immune system begins to wane. And then we have people that are diabetic, because when you're diabetic, you have hyperglycemia, and when you have hyperglycemia, it affects the immune system, especially a certain group of cells called the T cells. These T cells are affected and they cannot function properly. And then we also have people that have high blood pressure, being affected by this, being more vulnerable by this infection. And then, of course, people with cardiovascular diseases. When we say more vulnerable, it means that you could have a mild case, you could have a moderate case, and then you could have a severe case. Usually severe cases are people that normally have underlying infections and underlying diseases with the COVID-19. So these are the people that are more vulnerable. And yet there's a group of people that you don't find any underlying disease, you don't find, they're not within that age bracket, susceptibility bracket, but yet they come down with this infection. And scientists are beginning to look at the possibility of genetic susceptibility, and there are particular proteins in the body called the MHC proteins, major histocompatibility complex proteins, that are being profiled. So it is very possible that we can detect susceptibility to different infections from those proteins. So here we are. So, but those are just a minor part of the population, infinitesimal as it were.
What are some of the control measures?
Yes, for now we're talking about physical control measures. We're talking about social distancing. We're talking about face masks. We're talking about no handshakes and all those measures. But the truth is that as a nation, lockdowns, and of course, in this part of the world, it might not be sustainable, because if you look at those people that are practicing lockdowns, they have the capacity and the financial means to do so. Here in Africa, we're operating a depressed economy, so we can't really last long talking about lockdowns. So other strategies are there. Biological control. Apart from the physical control, why don't we include biological control? In other words, if the immune system is able to get 95%, like I told you, why don't we optimize the immune system? Say, can the immune system go from 95 to 96 to 97 to 98 to 100%? Can we optimize the function of the immune system, the efficacy, the power of the immune system? That's one strategy. And then can we also look at agents that can inhibit the virus? And then can we also look at other things, other mechanisms, biological mechanisms in which the virus works with? Now, control measures, you probably were talking about prevention and then treatment. Prevention. What makes your immune system weak? Why are you vulnerable? Why will a COVID-19 infection become severe in somebody that is about to be infected? Because of lifestyle. One, nutrition. There's what we call oxidative stress. If you're not feeding well, and you have exposed yourself to so much stress, to so much pollution, you've exposed yourself to tobacco smoke, to air pollution, and there are a lot of oxidative stress, a lot of free radicals in your biological system, in your body. Then, of course, your immune system will be weakened. Then, of course, you'll be immunocompromised. And then, of course, you'll be more vulnerable to the fatality, as it were, of COVID-19 infection. So it's a game of balance of the immune system in fighting, protecting us, and then fighting against this infection.
So what are some of the treatment strategies?
Now, first of all, you must understand, if you have a mild case, first of all, it could be asymptomatic. You are probably infected, you don't even know that you are infected because of your immune system. Your immune system is so good. It boils down to the immune system again. It's also the immune system that makes it mild. It's also the immune system that makes it moderate. And it's also the immune system, when it fails, that makes it severe. For example, if somebody has gone through chemotherapy in the last 2 or 3 months, you want to protect that person from an infection, because chemotherapy usually wipes out the immune cells. So that person is immunocompromised. That person cannot face the challenge of an infection with the SARS-CoV-2 virus. So you want to look at how do you build this immune system before and after infection. Everyone should prepare as though he's going to get infected. That's biological control. Let us beef up our immunity. So, because we're talking about an invisible enemy, you don't even know where it's going to come from. So let us all prepare as though we're going to get infected. Now, just for instance, somebody has been infected. What are the 3 strategies? Now, we wrote an article, it's under publication now. It's called COVID-19, a tale of cellular oxidation, a tale of viremia, cellular oxidation, and immune dysfunction. I'm going to explain the 3. First of all, you are infected with a virus. Virus gets into the blood, it multiplies, gets into the cells, hijacks the replication process of the cells, and the virus begins to multiply radically, sporadically, and fills the blood and fills all the body fluid. At this time, when that happens, what the virus does is that it blocks a certain chemical, biochemical, angiotensin in the body that protects the heart and the lungs. That is one. Number 2, it evades the immune system. In some ways, some cells that are supposed to kill it and attack it initially are not able to kill it and attack it initially. For example, the virus suppresses, there's a biochemical that is called interferon type 1. It suppresses that interferon, and because interferon type 1 is not produced, your natural killer cells, the cells that God has ordained to fight viruses and tumor cells, cannot be activated. So you have another group of cells fighting already. And then again, what this virus does is that apart from attacking your throat and your lung cells, it also attacks certain immune cells we call T cells. So the first thing that happens is that it reduces the T cell population in the blood, making the immunity weak. And as this virus multiplies, then another group of cells come up and begin to fight. And as they fight, they release what we call free radicals. And as these free radicals are released, there's what we call oxidative burst. There's oxidative stress in the body. So one of the strategies of treating COVID-19, which I want our clinicians to take very seriously, is aggressive antioxidation. You provide antioxidative supplementation to your patients. I'll give you an example. When you have this infection, you'll probably be given vitamin C. You take 1,000 milligrams. But the argument is this, that you'll probably be needing more than this dose because this virus is overwhelming the system. So aggressive oxidation at this time is antioxidation at this time is very, very important because it clears up the oxidative stress, increases the power of the immune system to respond, and then there's a balance. The immune system wakes up and then begins to fight the infection. For those that have undergone aggressive antioxidation, what you discover is that you have reduced hospitalization time by 4, 5, 6 days because you've reduced the power of the virus, the viral load, because you've increased the power of the immune system to fight. Naturally, these viruses are what we call self-limiting viruses. In 14 days, in 3 weeks, they clear out of the system because the immune system responds. What you now do with aggressive antioxidation is to clear out all the waste that this virus has created, beef up the power of the immune system, beef up your natural killer cells to respond, beef up your interferon 1, type 1 to also respond, and then of course the immune system begins to come alive and then it takes responsibility. So what we are saying is that the greatest drug, beyond any tablet, beyond any concussion of COVID-19, is the immune system itself. How do you prime the immune system? How do you enhance the efficacy of the immune system to fight infection? One of the ways is that aggressive antioxidation. Now, people are talking about doses of vitamin C getting up to 8,000 milligrams at a time, because once you take vitamin C orally, you are talking about bioavailability. How much of it does it get into your blood? Maybe 30 or 40% gets into your blood, and the amount would have reduced again. So if you take it more aggressively, as people are advocating now, and they are calling for clinical trials on this, you will be increasing your rate of antioxidation and increasing the power of your immune system to fight. So that is very, very important. Antioxidation, still talking about the antioxidation, you talk about, I call them antioxidant beverages, your fruits and your vegetables. If you tell somebody, take fruits and vegetables, and somebody says, okay, I've taken 2 oranges, that's not enough in this case, because an orange will probably contain between 5 to 7 milligrams of vitamin C. That's not enough. 1 tablet of vitamin C at the pharmacy will go for either it comes in 100 milligrams or 1,000 milligrams. So if you are going to take, if you are going to fight this infection and you are going to go on vitamin C, you'll probably be needing 200, 300 oranges at a time to do that, which doesn't make sense. So to encourage greater consumption of fruits and vegetables, you can make beverages, antioxidant beverages, carrot juice, a lot of cucumber and everything, so that you increase morning, afternoon, night. The truth about it is that any plant extract that has antioxidative effect and anti-inflammatory effect would be able to combat COVID-19 effectively. So you'll probably be seeing more cures, people discovering more things, because they have gone the way of the antioxidation strategy. The second strategy is what we can do that can help us is also to attack the virus itself. We have looked at that. There are several agents. People are talking about remdesivir now, that's come out in the US. It's gone under clinical trials, and they say that it will reduce hospitalization time by 4 days. Chloroquine is another one, an hydroxychloroquine. Hydroxychloroquine is safer. What the chloroquine does is that it creates a basic environment. It goes into your cells, the food vacuoles in the cells, which are acidic. It creates a basic environment, increases the pH, and therefore when the virus gets into those vacuoles, their proteins are misfolded and they're destroyed. So that's the strategy in which chloroquine employs. Chloroquine also frustrates the entry of the virus into our cells. So our old-fashioned chloroquine is still very, very effective. But the safer version of that chloroquine is hydroxychloroquine. It works. It has been proven to work, and I think clinicians all over the country and globally should pay more attention to it. That's another. So we've worked on several others. We released a document, a paper, a journal that talked about ramectin, which you get from cloves. The Yorubas call it kanofru. And then another one, ellagic acid, which comes from walnut specifically. So we discovered that these two can effectively inhibit the virus. And the good thing is that while ramectin will have to go through drug development and then move into phase 1 of clinical trials, ellagic acid is already a food supplement. So it can be tried. It can be tried all over the world right now as we speak. Go directly into human the phase 1 of clinical trials, and then see, because we're not talking about drug discovery now, we're talking about drug repurposing in this case. So we could look at that. And then the third strategy, we've talked about antioxidation, we've talked about inhibiting the virus. The third strategy is immunomodulation. How do you modulate this immune system? Why do people die of COVID-19? People die of COVID-19 not because of the virus, but because of the exaggerated response of the immune system to the virus. When the immune system is not balanced and the right type of immune system, these immune cells are not fighting, what the body does is to release other cells to the site of infection, and they aggressively begin to fight. And these cells release chemicals that we call cytokines. And these cytokines not only attempt to inhibit the virus or fight the virus directly, but they also affect the body tissues, which is counterproductive to the body system. For example, when it comes to the lungs, because the lining of the lungs are so thin, when you have those inflamed cells, certain of your immune cells will go and attack your virally infected cells. And once your lung lining is damaged, water begins to seep into your lung sacs, and then you have difficulty in breathing, and that's when you need a ventilator and all that. So it is called cytokine storm. The body itself is fighting, is overreacting. So in the case of a cytokine storm, how do you know that you are going to have a cytokine storm? Medically, it is very, very possible to detect or predict that a certain patient will have a cytokine storm, even without manifestation of the symptoms. 24 hours after hospitalization, a simple thing that people can do is a blood work. The ratio of the neutrophils over the lymphocytes will tell you that this particular patient, even though he has not manifested visible signs, is heading for a cytokine storm. And this particular case will not be mild, but this particular one will be severe. So right from the first 2 days of hospitalization, clinicians should be able to separate and say, look, patient A, go this side, patient B, go this side. When that has happened, second phase is that the clinician should also try and stimulate cells that God has ordained to fight this infection, the natural killer cells. And of course, there are supplements and there are biological ways to do it, to stimulate those cells so that those cells go into action, help the clinician to fight those viruses before it gets further complicated into a cytokine storm. And then, of course, advanced stages, the clinician should prepare for full-scale war because those cytokines will be released and they're going to fight and they're going to try and destroy the body tissue. So how do you block the pathways? How do you inhibit this? How do you inhibit that? So 3 major strategies really. Number 1 is antioxidation. Number 2, that is why almost any plant. Now, this is a bit delicate. It's not that people should go and swallow up anything, but usually what we do is that if you go into Google and say, look, I want to take this plant. What is the name of the plant? And I get the name of the plant, XYZ plant. All I need to do is to type acute toxicity. Once you type in acute toxicity, and the acute toxicity, if at 5,000 milligrams per kg, that's around 5 grams per kg, there is no side effect, there is no toxicity, there is no death on experimental animals, that extract of that plant is considered safe. I'll give you an example. There's this Igbo, vegetable, we'll call it utazi, Gangronema latifolium. So it's very safe at 5,000 milligrams per kg. That means that you can drink, that means I'm 70 kg. So if you multiply by 5,000, you know what that means. I can drink and I'm safe. It has a powerful antioxidant, it's a powerful anti-inflammatory agent, and basically it will work because when the viruses are multiplied into millions, because one cell, infected cell, is now a factory, can produce hundreds of viruses, and that's going to generate a lot of oxidative loss, a lot of oxidative stress. So if that is reduced and calmed down, then the immune system will naturally pick up. So whether somebody say has found a cure, the actual truth is that any good vegetable that we eat, the extract of it, the hot water extract of it, can be used in combating COVID-19. So save your money, that's another information from us. So that's on the part of antioxidation. And then inhibiting the virus itself, we've talked about that. Of course, you can get agents. We have worked on, we've published, and we're publishing more on that. And then immunomodulation. Where are the natural killer cells? These cells, these viruses evade the activity of the natural killer cells. And we need to activate the natural killer cells to fight against this infection. If we do that strategy, then of course, all those red lines you see every evening on TV, and you discover that the numbers will be stagnant, and then you discover that more people are moving into green line, and that's the discharge line, and more people are getting out of COVID-19. So it is not as fearful as it is being projected, really. It is not a sentence of death. It is highly compatible. We can knock out this infection and move on with our lives, really, through additional biological control measures and therapeutic strategies that will aid combating this infection.
Any final word?
Yes, final word. We need to sit down. The authorities, we need to sit down. We need to re-strategize. People are talking about lockdowns, and the truth is that there's so many things. If you weigh the economic losses of shutdown, the health implications of shutdown, you probably know that, for example, in Nigeria, we're talking about over 100, but we have not counted the effect of somebody having a heart attack in the house that is dying at home, somebody that needs chemotherapy that cannot go to the hospital, somebody dying of diabetes. We've not accounted for those figures. So can we sustain this lockdown? That's a big question. My worry is this: I think we need to sit down and re-strategize. Look at how we are going to look at add biological control measures to what we are doing. When we do this, then of course COVID-19 becomes something like common cold.
So, any final word?
A final word. Two key areas that we've talked about: prevention and treatment. Now, for those wanting to prevent COVID-19 infection, there are key things that we must know. we must know that at any time our bodies should not be under any oxidative stress. If we are under oxidative stress, our immunity is weakened. And this borders on your lifestyle. Are you smoking? Are you exposed to any air pollutants? Do you have any underlying infections or diseases? So this is very, very important. If you have diabetes, you have to manage your diabetes very well. If you have any other underlying condition, you have to manage it very well, and don't expose yourself. So the whole idea about this is that if you were given a challenge, say, look, Mr. So and so, you are going to be in the office in the next 1 week, and you are going to be exposed and be working with people that already have COVID-19. How do you prepare yourself? The first thing you do, reduce anything called oxidative stress. Second thing is to boost your immune system. And you do that by your lifestyle and your nutrition. And of course, keeping away from diseases, managing your diseases that you have very, very well. And then the second area we talked about is treatment. Under treatment, I talked about 3 clear areas. The first one is aggressive antioxidation. How do you undergo this? Your dose of vitamin C should be increased. Now, you probably talk about increasing the dose from maybe 1,000 milligrams to 8,000 milligrams per day. So when you do this, you'll be reducing the hospitalization time by at least 4 to 6 days. In other words, somebody can be infected today and in 6 days' time is discharged from the hospital because of aggressive antioxidation. So it is very, very important we know that. And then this should come along with inhibiting the virus. Of course, another way you can do aggressive antioxidation is with your antioxidant beverages, like your fruits and vegetables. What do? You got a news that you've been infected by COVID-19. Your fruits and your vegetables, make beverages out of them and drink them aggressively. Of course, we heard of a governor in the Southwest that went through this, and of course, it came out very successfully. Now, you may say, oh, maybe he wasn't even going to die in the first place. But have we asked ourselves, what is the effect of this antioxidation on his system? Has it reduced hospitalization time? Definitely, it has brought health back to him. Once you increase your antioxidant in your body system, then of course your immune system will be improved, and of course the virus, which is self-limiting in itself, will be combated more effectively. The second strategy is to inhibit the virus. What are the agents that can inhibit the virus? Of course, we are talking of new antiviral agents that are coming out now, but chloroquine has shown itself, and hydroxychloroquine, which is safer, has shown itself to be very, very effective. We can use that also. And then please, it's very important that people use it with prescription, because chloroquine, there could be acute poisoning of chloroquine. And then the third thing is altering and enhancing the immune system. How do you enhance the immune system to fight the infection? Clinicians should please look at this. For every case that is severe, it is definitely going to turn to a cytokine storm. How do you diagnose a cytokine storm even before it ever occurs? We've talked about that earlier, and of course you can do that immediately, so that the first day of hospitalization you can separate a moderate and a severe case and begin to handle with greater attention. So, my listeners, the import of this presentation is to tell us that COVID-19 is not a death sentence. We've been through Ebola, we've been through Lassa fever, we've been through worse infections, and we pulled through. Now, if we take all these things, all these measures we've talked about, the strategies, inhibition of virus, modulating the immune system, and of course antioxidation, we will discover that we'll have better results, far less mortalities and morbidities and sicknesses that we have now. We can overcome this challenge if we work hand in hand. God bless you.